And joining us now is Dr. Leslie McClure, professor and chair in Drexel University's Dornsife School of Public Health. Dr. McClure, thank you for being with us.
Thank you for having me.
Pfizer says it expects to produce up to 50 million doses this year alone and will be ready to distribute that vaccine within hours of authorization. This is all moving very fast, so let's discuss the timeline here. How soon could the vaccination process start, and how long can we expect it to last?
Sure. So you're correct. The 50 million doses, remember, this is a 2-dose vaccine. So that's about 25 million people who could get the vaccine by the end of 2020. The company has already been manufacturing and shipping the vaccine for the trials to 150 sites around the world. So they're already prepared, and based on their press release that indicates that they'll be shipping within hours of emergency authorization, my guess is that they're already manufacturing it now and ready to begin distribution.
And Dr. McClure, there are other vaccines in the pipeline, right? And we know sort of how it's going to get rolled out, first responders first, and then down the line to who really needs it. From your point of view, when do we think that people who want the vaccine, that's a whole other conversation, the people who aren't going to get it, but when do we think the people who want, everyone who wants the vaccine would be able to get it in your mind?
So first of all, I hope that everyone will want to get the vaccine because that will ensure the most effectiveness. I believe it's about 6 months from the emergency authorization that they can get full authorization. So once they get the emergency use authorization, it's not approved yet. So it will be at least 6 months before they can start rolling it out to everyone. And then it will be the rollout will be phased so that different groups of people will get it at different times. So it's hard to say, and it's all based on their speculation that the approval process will go smoothly.
Still a lot of questions, but
For sure.
The rollout is happening quickly. Dr. Leslie McClure, thank you so much for your time.
Thank you for having me.